Yeah.
99% of stuff always works here. For some reason, that guy is not our friend today. It's or girl. But, so basically, we're going to be trying it on there. If you guys can't see, so you either post it or we can get it on Google Classroom so that they can look at it on your phone.
I shall be back.
Wait, who has the mouse?
Me.
Oh, can you just put it in for that?
Whoever wants to go can go next. She told me to fix the motion.
Yeah, can you be more
Fix the
excited?
Sorry.
We're going to be like,
That's the bystander effect.
Good luck, Brooke.
Good luck, Brooke.
Hey, Brooke, don't mess up. You got it, though.
Okay.
Okay, so you guys, especially you guys, like Avery, you got a long distance there. But if you guys can't see, let us know, and then you can try to pull it up on your phone or something like that. Obviously, make sure you're staying on task. So today, we're going to be talking about medical. Oh, by the way, the interviews, you'll be kind of just what you saw happen there. You'll be pulled out individually throughout class to go through interviews with Veda, who you guys know, and then Kate as well, who you get to meet. All right, so starting off medical emergencies. Changes in consciousness. So we're going to focus on first, obviously. First thing we're going to be looking for is what does conscious mean and what does unconscious mean. I feel like that gets tossed around a lot, so just a quick clarification. Someone's responsive, we talked about with the midterm, like the AVPU, the AVPU, right? Checking responsiveness. So someone who is responsive is conscious, someone who's unresponsive is considered unconscious. But the note to that you see right below there is not all responsive victims are fully responsive. So you can have kind of a mix, and again, back to the AVPU, right? The parts that we'll learn for the final are going to be painful stimuli, for example. And so someone might be unresponsive to you talking to them, but responsive to painful stimuli, which is like pinching them or doing something called the sternum rub. We'll talk about that later. But what to do, so if they're unresponsive and not breathing, the two aspects, and not just one unresponsive, but also if they're not breathing, you're going to go into CPR. So you guys all took your CPR class, you know how to do that. If they're unresponsive and vomiting, for example, you want to roll them onto their side and call 911. Why do you think you want to roll them onto their side, Jake?
Prevent them from choking on vomit.
Great, perfect. So rolling them onto the side, just to say, like they vomit almost out of their mouth, which is better than, again, if they're laying on their back vomiting, basically back into their throat and then in their lungs, and then, everyone knows that's
All right, so AVPU. I think you've heard us say this a few times, but this is going to be you to, assess someone's level of consciousness. So A, is they're alert, they're talking to you, they're answering the question. Right now, Thomas is alert, responding to me. Alert. B is the alert to verbal stimuli. So this is maybe someone's laying on the ground. As soon as you're like, hi, can you hear me? They're up, they're looking at you, maybe they're responding, saying something. P is where painful stimuli, so this might take, like Thomas was saying, like sternum rub, into the ear, they're giving a nice little pat, and like movies always slap someone like that. And then U is completely unresponsive, so they're just not giving you any feedback.
What's the difference between alert and alert to verbal stimuli?
Yeah, so alert is that, like, again, Jillian right now, alert. But let's say someone's not alert, just, like, I don't know, like, right now, all of you are alert. You're looking at me, you're engaged, you're sitting up, you're able to, talk to me. Alert to verbal stimuli is more someone who might have seemed unconscious, but as soon as you kind of are like, hi, like, are you there? Can you hear me? Then they can start to come to it.
All right. So next is, it's a kind of a strange jump, but okay. We're going to start talking about anaphylaxis. Anaphylaxis is also kind of another, somewhat interchangeably for an allergic reaction. So first off, just focusing on the anaphylaxis part is it's a type of shock, and it's a powerful reaction to substances that enter the body, so things that the body doesn't like. Obviously, I'm sure, well, not all of you, but maybe some of you guys have allergies to certain foods or just have seasonal allergies. And with that kind of comes along reaction to powerful substances again that enter the body. So some common causes are medications, foods, insect stings, and ants.
Would you say the replacement for that one?
Yeah, so anaphylaxis is basically caused by an allergic reaction. So
Anaphylaxis is like a serious allergic reaction. So honestly, you can have like allergic reaction, like you have like a lotion or something, like or something, like, like a red allergic reactions often can, go into anaphylaxis, which is kind of a worse version. That means very much affects a lot of the Okay, so recognizing anaphylaxis is super important because this is going to be one of your practicals and your finals, so you want to know what to look for. So breathing difficulty, that's a huge one. Skin reaction, so hives, bumps, something like that. Swelling in the tongue, mouth, or throat. Sneezing and coughing. Tightness in the chest. Blueness around the lips and mouth, which often is, a sign of difficulty breathing. Dizziness, and then nausea and vomiting. So a long list, to say the least, but all of these things really can be associated with allergies, and people who do have allergies often know, like, oh, I always know I get super dizzy and nauseous right now when I'm about to go into anaphylaxis. All right, care for animals. Yes, we get to do the EpiPen today. It's very important. So call 911. That's your biggest thing. Anaphylaxis. There's not a ton you can do to make everything better. If you want to get to the hospital because it can reoccur, you can give an EpiPen and it can get worse. So definitely call 911 your first step. And then if the victim has his or her own EpiPen auto-injector, you can help them administer it. So we're going to go over how to use that as well. So just very simple steps before we give you a demonstration. So you remove the safety cap. Thomas, can you grab the fake one? Yeah. Or are they downstairs? They might all be downstairs.
What?
They might all be
I
downstairs.
think they are, but they have
Those are the old.
some real, some fake.
Okay, I'll have it in there.
Good one. I like whoever said that. That was fun.
Okay, so you remove the safety cap. That's like the little blue cap over here, right? It easily comes off, not an issue. Blue safety cap. And then you just want to hold the leg still. You're going to be on where's the most fat, so just right on the eye. And then again, it shows you, obviously, it's going to be this little orange part is where you're going to want touching the skin. And then this is fake, you press it in, you'll hear something click. Usually it says hold it for 10 seconds, yep, and then you let it go. And obviously it doesn't actually look like this, but this is similar to what actual EpiPens look like. They come in a little case, you take the cap off, put it on the thigh, push it in, hold 10 seconds, and then let it.
Is it bad to put it in certain parts of the body?
Yes, that's a good question. More often than not, no. It's a needle, it's decently big.
Yeah, I've seen it.
Yeah, they're decently big. But the main concern is just to get the epinephrine pumping, and that's why you do it in these super, like your thigh, or sometimes you could do it in your arm if you wanted to, which is probably more painful. Is so that it's not, hitting any, I guess the main thing is you wouldn't want it hitting any major arteries.
Yeah. Okay.
But it's not, again, not something you really have to worry about. Carol.
Do you when you're treating for anaphylaxis, treat for shots or
Yep. Yeah, I think I have that in your textbook. Under steps to treat for anaphylaxis. I'm sure that will be a question on your next group. But yeah, treat for shots.
So it's just different colors and everything, different colors can make different things.
Wonderful question. So yeah, we have pediatric and adult. Most kids, honestly, all of you guys would have adult. Stay with me. You know what I mean? We all have adult EpiPens. It's more just weight. I think it's over 100 pounds, something like that, or over a certain, something like that. So the colors don't really mean. It kind of depends on the brand. All of them are a little bit different. See, for instance, with these, this you can see says 0.15. That's going to be the kids dose. That's going to be the pediatric dose. But there's also yellow, and again, it says the dose on it, and 0.3, yeah. 0.3 is adult, 0.15 is kid. So yeah. Again, different brands have different ways of distinguishing it, but these ones do happen to be different colors for different ages.
Is it possible for something allergic for what product comes?
Yeah, probably.
Probably, yeah. People can be allergic. But that would be a very special case scenario, and then in that case, they wouldn't have one. And that's why we ask our sample questions too. But yeah, inside EpiPen is the epinephrine itself, which is basically adrenaline. Yep.
When you're going to use an EpiPen, is it such an emergency that you want to do this, or would you do what they do in the doctor's office and rub where you're, or disinfect the spot?
carry these anymore because they're super expensive and they're hard to find, and we'd rather people with allergies, you know, have these at home, and then when needed, we can come when we have syringes that we draw it out of and we give like a shot. And in that case, we definitely do. I would definitely recommend if you have a little alcohol prep pad or a wipe or something, just wiping the, you know, area down and exposing the wound, or like exposing, sorry, like the place you're going in. If for some reason you can't find it, you know, you're in the middle of the park, no wipes available, not the end of the world.
Seems like when sponsors like deal with not it's like a shop.
Yeah.
And like they use samples, should you still like use the antibiotic and try to use sample?
Yeah, I would say go for it. If they're unconscious, again, that goes with our consent. That's you know, implied consent. They obviously can't make decisions for themselves, so we would hope that they would want us to help them. If they have those signs, and especially, you know, with those medical ID bracelets, maybe you see they have an allergy and they have an EpiPen that they carry on them, which most people with allergies should carry EpiPen. So.
These aren't dirty, by the way. I'm just disinfecting.
Does anyone here have like? Does anyone here carry EpiPen?
My sister does, yeah. Like my mom does.
Oh yeah. Anyone else? Sorry. Well, because you're allergic to a lot. Do you carry an EpiPen with you? Is it in your backpack right now?
So my question to you, Wilkins, is what if you have an allergic reaction right now?
Well, that's a pretty good place to be, probably.
Yeah, and I have to provide oral steak and I have other medicine every day for
Has everyone, or have you guys had a chance to try? Do we go through the directions already?
Yeah, so we went through the directions. We'll do it with you too, so.
So we don't have enough
It
to-
won't work with the safety cap on, so don't mess up. Then,
We'll do it twice with you guys once we get there.
die, press it in, doesn't hurt. 10 seconds. You don't actually have to wait 10 seconds. I mean, we could for the effect, but I think you guys do.
Isn't it like blue sky and another
Yeah.
Exactly right. You ever heard that one before? That's a good one.
You're not wrong there. Blue sky, you don't know.
That's exactly.
You can think of that when you're doing it. In your practicals, if you forget, remember, oh, Fiona said, blue sky. Just remember, take it off.
Oh.
And you'll see with the safety cap on, it's not going to work like Dalton is trying right now.
Yeah.
It's just not going to, yeah. And then what we'll be able to do is, because we have a ton of expired EpiPen, we can do a little demonstration.
Wait, so you expire after 1 year?
Well, after 1 year, there's no more epinephrine in it. So what did you go expire? Because we carry a bunch of these, we have to have 2 in each ambulance at all times and 2 in each fly car.
Yes.
At least.
They're trainers, so you can just touch
So,
them.
yeah.
Like they're not gonna like stack them.
Yeah.
So they do go expire now. Sometimes it's a year, sometimes it's 2 years, but we have to, it's usually about a year we have to get them renewed.
So wait, did you say you guys don't carry any pens anymore on the ambulance? or-
Yeah, because those things are wicked expensive. So what we do is we carry like a little like vial full of epinephrine, and we like suck it up like through a syringe, and then we like stab the person.
So it's the same thing, just prepackaged.
Exactly. Yeah. Right.
Have you ever had to use an EpiPen on someone?
You Sally and I went on a call. Were you using it? Were you on that call?
Aaron?
You were there. It was well, I don't know what I was.
You did?
We were all there.
Yeah, I did not get to actually do it, but I was there and I cleaned the wounds like our friend Aaron was talking about. But I just like gave oxygen and I was not the main EMT, but
Yes, so.
I just want to know, I guess, how big it was, because once I saw 8 weeks in EpiPen, we, went through and kick garbage.
Yeah, we're gonna go through a garbage can.
how did you see Tate do that? Were you like,
Yeah, how did you see Tate do this? Oh.
Oh, I was gonna say, were you like in the class?
Yeah, no, so that's what we're gonna do. You can go through the garbage can here. They're really powerful. They're spring loaded, so they're gonna like smash right
Right.
there.
Yeah, I've
This
seen
garbage can has been used to do these examples for these first aid class for years.
Yeah,
Like,
it's kind of fun.
Needles are
This is the only time we get to explode them, now explode them, but you don't
okay, so safety cap.
Wait,
off.
what's your saying again?
Blue sky throwing it out.
Blue sky,
I
orange.
guess that's what I mean.
Something like that.
How do we do this for everyone to see it?
Oh.
I
We see it when they want to see like
How can we just-
Yeah, we'll do two. All right, how about this?
This
You
side of
get-
class, you can come up.
Wait,
No, there are more people here. We'll cut. Sorry, Andrew. You'll be next time. You guys come up and gather around. Don't touch each other. I don't know why you would. That sounds a little weird.
Circle distance. You're not.
Yeah.
Okay.
What's the position you would do to like put this in when I feel like
No, I put it, it's not gonna go anywhere.
Yeah, no, so it's not much to, I think just kind of, just make sure you're hitting them kind of right here. Keep them behind them in front of them, whatever.
should I be sitting down when you do this?
Sitting, standing, whatever. Make sure you're.
That's what they did last time.
Or we can do this in time.
Oh, I think I would say
you-
for fun.
You will, but you won't use a real one. You would just.
One
One of the practicals, yeah.
It's not an app. They want to see the needle on this
Yeah,
side.
okay, we got.
Is everyone watching?
Oh, I can see
It's
it.
gonna squirt right out.
Yeah, I know.
Oh, wow.
Look, come look at me. Be careful.
Oh my god. Oh.
Alright.
Then it auto goes back into herself.
It also did spray. That's not that fun.
Wait, so they're not exposing the.
When your brother did it in our class, he like shot it across the room.
Yeah.
Yeah.
Well, maybe let's try green. Let's try green.
Sorry.
Green is just pediatric one.
Alright, so, just so we know what the exact method for all these.
Alright, you guys can come gather. Oh. See, there are 100 different kinds. That's why you should know which ones you have.
You pull off into the left side. Because it's not really.
Blue sky, other side of the sky.
But these are not the ones you get to use.
This is easy. It's an easy.
See, that one had two blue sides, so you could get three times up.
Yeah, but if you shoot it back.
Okay.
That's really tough.
Well, we just go the other way.
Yeah.
No,
Well, you
you're
can look at how long it
trouble.
takes you to
You're
shoot
gonna
it.
get a shot at it. Again, it's not like.
I know.
Okay.
Just go to you. This right down.
Blue sky.
I wrote down like the sides so you can see how it's more than you.
So, no, but that's right. Alright.
I'm not gonna. You know me shop at the.
You're not gonna get shot. It's like super nice.
You might get a little more.
Alright. You just press it in and you can go black. Ready?
Oh, that's a good one.
That was a really good one. See that needle? Yep.
And then when you pull it out, it like auto goes.
Yes, it'll.
Did I miss this?
Alright, fine. Oh, there it is. Alright, so now watch this. So now I take it out. So this is their thigh. Now we're in their body. And now, now it's immediately the end of the
Have you ever
face
given
here.
to start that even?
No. But I call 911 like after.
Oh, really?
That's pretty
Do you like have conversations with dispatchers? I think now that I'm in coach, if I ever like had to call 911 and it wasn't like serious, I'd be like, hi, I'm Sally. You probably heard me on the radio.
So these, by the way, go in a sharps container. They don't go in the garbage. This is a side note.
Really?
I mean, they're fine to go in the garbage because they have like little safety caps, but they're supposed to go in the trucks. You can just keep going. I got the question.
Okay, so breathing difficulty. So this is, as you can see, a very
Thank
common
you.
thing. There's a lot on this slide, so pay attention. So causes of breathing difficulty for first aid, for your knowledge, there's lots more things that can cause you to have difficulty breathing. But what you should know, asthma and hyperventilation. So asthma, obviously, is just a lung condition. Lots of people have it. Sometimes it's exercise-induced, sometimes it's just chronic. And hyperventilation is when you're breathing too fast, when you're taking in not enough oxygen, too much carbon dioxide. So recognizing breathing difficulty. So if it's abnormally fast or slow, not good. If it's abnormally deep or you're gasping, so if it's super deep like that, not good, but also if it's super shallow, like we talked about shallow breaths last class, I think. So noisy breathing, also anything that's wheezing, gurgling, growing, or snoring. All things, if you hear this when someone's breathing, it's not a good sign. That's not normal. Bluish lips. Anyone know why lips would be a little blue? Brooke?
Would be like a loss. Actually, that would be but
Oh, no, keep on.
would it be your lungs? Is it not like your air?
Yeah, not enough oxygen.
How does that make it blue though?
Yeah, so it's not, so you're right, it does go into circulation. So everything connects everything. So if your airway's not open all the way, your breathing's not going to be good, and then therefore you also go into your C's, so your circulation, not enough oxygen going around your body. So, like least important, like your fingertips get cold, your lips get cold, stuff like that. And then pause when speaking, so you can't complete a sentence without going to text. So care for difficulty breathing. So you want to place in a position of comfort. A lot of times this is not laying down, sometimes makes this worse. I know after I finish like a track race and I'm really wheezing, I try to stand up with my hands on my head. So something like sitting down is probably best. Call 911, this is a big one because this could get worse pretty fast. Assist with an asthma inhaler if needed, which again we'll talk about in a minute. And then in hyperventilating, have the victim inhale, hold breath, and then slowly exhale. So this is really just coaching their breathing is important. For anyone who's hyperventilating, you really just want to calm them down and try to get their breath and their breathing rate to a more normal.
All right, back.
Fiona,
Okay.
Oh.
No, I'm good, I'm good.
Kevin,
Do you bring in cameras on the internet?
wonderful question. We do not have our own inhaler. We'll help them if they have one on scene. Our kids can have one. But our medics do have the same medication that you get inhaled, like albuterol, and that can be given through a low vibe breather or something like that.
And are we allowed to give that to them, like medication wise?
If they have one on scene, you can assist them.
So what do you mean by assisting exactly? It's like
Yeah.
walking you or what?
Yeah, you can. Well, again, I think maybe it doesn't talk about it, but an inhaler you can assist just means you just take off the cap, they take a breath, and then take a bunch of big deep breaths. So in your practical, for instance, if you needed to do this for some reason, you could say I would assist them with their inhaler. You don't carry them, so you don't carry them.
All right, cool. So we're going to talk a little bit about chest pain. So things that can cause chest pain: heart attack, an angina, respiratory infection, and overexertion. Resulting in muscle pain. And due to movements.
Okay, so care for a heart attack. So big one is call 911. As we all know, heart attacks are very, very serious. A life-threatening condition. So have the victim rest. This is a big one. Don't exert any force or overexert the victim. Keep them relaxed. You want to keep their heart working as little as possible. And help victim take prescribed medication if they have them. So again, this tricky question, just say I would help my patient take the medication if needed, but if they haven't, and getting it for them. And then give aspirin.
So next thing we're going to talk about is an angina in particular. So what is it? So it's caused by physical exertion, stress, or excitement. Some things that you want to look out for, especially during practicals that are down the road, or obviously in real life, is just if it comes on suddenly with chest pain. So if someone suddenly says, chest hurts or whatever, has shortness of breath that lasts about 10 to 15 minutes. So it's not like something happens for a few minutes. It needs to be a little bit more of a prolonged period of time. So it's a little bit different from a heart attack or cardiac arrest. Cardiac arrest, obviously, or maybe you guys know, cardiac arrest is kind of a different thing where, how do I describe it? Kind of like someone's not necessarily dead, but their heart is basically quivering in some sense, so they're like almost not about to die, but well, I guess.
Yeah, they're about to
They're
die,
about to
and
die.
then you do CPR to try to save them from that.
Yeah, exactly. And so the treatment is the same for that of heart attack, which I believe is just going to be to give them position of comfort and give them some aspirin. I think we might talk about it. We did. Yeah, we did talk about it. But yeah.
So fainting, this is like a really common call that we have here at Host. So this is just it's caused by decreased blood flow to the brain, which could really be caused by a number of things. Some that we know. Then recognizing fainting, so sudden and brief unresponsiveness. So someone passes zap for like 30 seconds or a minute, but never if it's like a really prolonged period of time, it might be more than just and then pale skin and sweating.
Alright, so how are we going to care for someone that has just fainted, right? So we're going to be checking for responsiveness. What's the acronym for checking for responsiveness? AVPU. Tap and shout's kind of part of that, but AVPU, right? Yep. So you're going to check for responsiveness, check their breathing. What's like the 3 words that we use for checking breathing? Sure, but how would we like assess that? You guys know what it is? Caroline? Perfect. Yeah, look, listen, feel. So that's going to be, I mean, that's going to all mostly for the breathing, of course, but that also kind of comes along with these. And provide care as needed. Again, that is kind of down here. So we're going to be loosening tight clothing, make it a little bit more comfortable for them. The tight clothing could be restricting, blood flow, but it'll also be hurting their breathing. If the victim fell, make sure you're checking for other injuries that they might have. Because when you faint, sometimes people will faint like standing up and then they'll fall, hit their head, hit their leg, break their arm. So that's just something to be aware of. Call 911 if needed. So basically, why should you call 911? You don't need to call 911, obviously, so it's a safe option. But if you definitely want to call 911, if it doesn't improve quickly, if there's repeated episodes of fainting, so if someone faints, it's better than faints again, or an elderly victim, especially elderly and also very young patients, like probably under the age of like 2 or 3. You also just want to make sure, that kind of goes for all first aid as well. Elderly and very young, you just have a little bit more caution and a little bit more awareness. I think their injuries could be a little bit worse than a more developed human.
Alright, so diabetic emergencies, another one that we see here and there. So diabetes is the inability to use glucose normally due to a deficiency in insulin. It's all, just really a definition is all we're going to give you. You don't need to dive too deep into it for first aid. Hypoglycemia is when you have low blood glucose, and hyperglycemia is when you have high blood glucose. So people with diabetes can slip into one of these states, and that's when you do have first aid.
A little quick English lesson on that. The prefix of hyper and hypo, they're the same for like everything, right? It's like hypoventilating, hyperventilating. I always think about it just to remember is like, if you have a lot of sugar, right, you're really hyper. Pretty clever, right? Pretty clever, I know, I mean, kind of awesome. Oh, hypo, almost like blue to sky, orange to sky. A lot of nice little rhyming there. So yeah, that's just helpful for you guys. So low blood glucose, here's a very quick pop quiz. What is low blood glucose called? We just talked about it last slide. Caroline. Nice, hypoglycemia. So things that you're going to be recognizing low blood glucose or hypoglycemia. So sudden onset, so that basically means that it comes on suddenly, kind of with the onset part there. Staggering, anger, pale color, confusion, sudden hunger, excessive sweating, trembling, seizures, and unresponsiveness. The last category there, especially the seizure and unresponsiveness, those are very severe cases. Your ideal, glucose level, let's just say, call it, around 100, reasonably. So that would be someone for low blood glucose. Sorry, I can't talk today. That has like maybe like 30 or 40. So those are very, very serious cases. Most of you guys right now are probably right around 100. Maybe a touch lower. Yep.
What are you doing to check this?
Oh, great. So you wouldn't necessarily have this as a first aider, so you just kind of want to be looking for the symptoms. On the ambulance, we have this cool little machine, it's like this big, that you take a sample of their blood, you prick them with a little, we call it a finger stick or a lancet. You get like a tiny, tiny sample of blood, and this machine sucks up the blood and tells you how much glucose is in there, or in that sample relative to the rest of their body. So that'll tell you what it is, and that's kind of how we know for sure. But again, for first aid standards, for the final, for general life, you want to be looking for these symptoms, because of course you guys aren't going to have what we call a glucometer. Yeah, Tristan.
What's the normal, what are you looking for in glucometer for it to be normal?
Yeah, so right. So once you get it in, so we look for anywhere basically from like 80 to 120. it's like prime range. Again, you guys don't need to know that, because again, you're just gonna be looking for the symptoms. You're not gonna know what their glucose is, specifically. But for at least on the ambulance, 80 to 120. 80 to 120 is a big number in EMS, because it's also like blood pressure stuff and stuff like that. But that's kind of the prime range that you want someone to be in. But again, if they're like 130 or if they're like 70, it's no big deal. Yeah, no.
I might have missed this, but does glucose affect heart rate at all?
Again, not necessarily something that you're going to need to know. If you have a low blood glucose level, I mean, basically anything that's out of the ordinary with your body is going to affect not only your heart rate, but things like your blood pressure and things like that. If we kind of, let's go back to the sugar thing, right? So if you're hyper, your heart's going to be beating a little bit faster. You're going to be moving around a little bit more. But again, nothing that you need to know.
Alright, cool. Alright, so care for low blood glucose, or what else is often called
Oh,
low blood glucose?
Oh,
I don't know what you said, but okay, so provide sugar. So, as you can see, it says provide sugar, period. That is your main goal. You want to get that blood glucose back up again, so you can use some sugar, candy. So this sounds pretty, ironic considering we're first aid, EMS, medical professionals. But sugar, candy, soda, juice is a big one, like juice boxes. Or glucose tablets or gel. So you're each going to get to see what a glucose tablet or gel looks like. We either have sometimes we have these powders, I think. We have those in some of the ambulances right now, or we carry a gel. These are like weird ones that we don't actually carry, but they often look similar to that.
the powder that you guys will get, the one that says Elevate, that's what we have in the ambulance.
Yeah.
And we also have these like little like
Those are most
cases.
common.
I guess I should.
The little like pouches thingies, those are like we don't actually usually use.
You guys ever see it?
no.
That looks like a fine.
Yes, the powder you
What do you say?
often have them like lick their tongue.
Yeah, it's
like
you know,
you know
like
what
for
funded
the
powder
second
looks like?
Yeah.
It's like if you just put that out.
Yeah. Thank you.
Oh yeah.
So it's not like super enjoyable. I was just telling Brooke
This
that
is
it's
the
like
powder
funded
one.
powder.
Are those specially made for?
Wait, you know
Yep,
what?
they're especially that one actually I don't
Yeah,
even
that's
know.
what I thought.
That looks like it's
Yeah,
like
it looks like
something
a
you would get before you like a
What
run.
did you, oh,
But that is especially made. That's
It's
a
these
metal
little
glue.
packets, so you don't mix with anything. If someone on our ambulance needs glucose, you just say open your mouth and you put this powder in just like you're like having like the funded powder. Yeah.
You want to just pass
People
that
will joke around and like have some of it here sometimes.
Could
It
you
doesn't
use
taste
funded?
bad, it just straight up sugar.
Yeah, exactly. So what I was saying is to answer over there is that those ones are like
It's where the
you know,
blood,
where you go like
where the blood control.
you can have one of those. But the other one that's still come around eventually is like a powder, the one that's Elevate, and that's like a specifically medical.
The trash can.
Oh wait, we have a great question.
Great question. Caroline, you want to repeat your question?
do you ever get confused, because like all the symptoms for these are super similar?
Yes, this is why I said it's one of the questions. It's something we did like have to go over applying an ENT class, because they're really similar symptoms and there's a few like defining things, but I'll give you a hint in your practicals, you're always going to have hypoglycemia, because hyperglycemia, as you'll see in a minute, you can't really treat it that well, because you can't take sugar out of their blood, at first, like that's not something we do. So always err on the side of they're hypoglycemic, because you'd rather give them sugar, and things can go really south when they don't have enough sugar in their blood. So you'd rather give them more sugar and then have them just be like super hyper. But it's a great question. It's a hard one to answer for first name.
Yeah, right. It's a great question. We don't have those on the ambulance. I have no idea. Probably like a yellowish red. Isn't it like strawberry banana or something?
Such a nice color.
Yeah.
I feel like it'd be like pinkish.
Did we pass these go both ways?
Oh, wait, here's the answer to your question. If you're unsure whether it's high or low, provide the same care as you were for low.
You want to make them even more hyper?
Yeah, wait.
Try this.
If they're super hyper, again, this is not anything you need to know, but if they're super hyper, they go into a state called like hyper ketoacidosis.
Oh, DKA.
Alright,
DKA, yeah, diabetic ketoacidosis. That's when it gets bad. And that's when if you put the blood in the glucometer, it just says high. It doesn't even give you a number anymore.
It just says hi.
Yeah, it literally just says high, and that's when you're like, okay, shoot, we should probably get moving. In gen, like, you guys won't have to do that for first year.
Alright, so high blood glucose. So we obviously just spent a long time talking about low. Just here's a little bit more about high though. So how are we going to recognize high blood glucose? What's it called?
Yeah.
Good job. So this is more of a gradual onset here. So this is going to be more of, whether it's over a couple hours, even, half hour, something like that. A little bit more gradual. People are going to be complaining of drowsiness, extreme thirst, frequent urination, warm, dry skin, vomiting, fruity or sweet breath odor, rapid breathing, and unresponsiveness. So again, the rapid breathing, I don't know, sweat breath. the rapid breathing and unresponsiveness again are pretty serious symptoms. So again, those would be high blood glucose. Again, we're looking at that 80 to 100, 120 range. High blood glucose is going to be like 300 to 400, and then they're really going to be feeling those very severe symptoms.
And this will all be, some of the topics to take in right now. There's so many symptoms, but just go through your textbook, find a way that you can really memorize it. That's the key one. So care for high blood glucose. So if you're unsure, if it's high or low, treat it as if it's low, which is
Hypo.
and then just, if it does not improve in 15 minutes, call 911. You guys know as first aiders, the answer to like all your test questions is usually ends with seek medical care.
I mean, even if it's like super high, like you still want to give them more sugar.
Well, see, the thing is, if you know it's super high, then you don't have an issue. But you guys don't, as first aiders, you don't have glucometers, right?
Yeah,
You don't do
yeah.
that. And if I were just like, help someone like, at school, I don't have a glucometer on me, so you're just going to have to go through that.
What happens if you give like sugar to a person who's hyper
Yeah, their sugar's just going to go up. I mean,
Okay.
like,
Give me
until,
that.
for a while, it's just going to go up. And then after a certain point, after I think it's around like 400, things start to, that's when you're going to really start to feel the symptoms, and that's when you really should go to the doctor.
And your body also has mechanisms built in, not necessarily, but once you get to those some of those severe numbers, it'll be your body will really start to work on that and try to return you to a more normal blood glucose level, like the frequent thirst and urination, to try to just clear your body with all that sugar or all that glucose. So seizures kind of we're switching a little bit more now to the brain. So this results from abnormal stimulation of the brain cells. So I'm sure you guys have all seen on, whether on TV or just heard about it, hopefully not in person, but have seen a seizure. So basically it's sudden violent muscle rigidity and jerky movements. Another word for, well, really both of those are convulsions. So if you ever hear someone say like, oh, it's convulsions, it's kind of referring to that, seizure-like activity with the jerky movements and muscle rigidity. Any questions on that?
So causes of seizures. So very commonly is epilepsy, which is a seizure condition. Or like that's I would say most seizures that you see would be a result of that. People know that they have epilepsy most of the time, or they will. Heat stroke can cause seizures as well as any type of poisoning. Electric shock, hypoglycemia, we talked about low blood glucose, super high fever. I don't know if you've ever heard of febrile seizures. Like a lot of times, like little kids, really young babies, they get a really high fever and it causes them to have seizures. And then any brain injury, tumor, or stroke, and any alcohol or drug withdrawal or abuse. So any alcoholic who's withdrawing could have a seizure, or anyone who's very abusive to alcohol.
So how are we going to recognize it? Sudden falling, unresponsiveness, and then of course the classic symptoms that we just talked about, the rigid body and back arching, and then jerky muscle. For the most part, it's relatively obvious, at least in my experience, it's relatively obvious if someone's having a seizure. And it doesn't have to be like their whole body convulsing, right, that key word there, convulsion. But it can just be kind of one part of their body that's moving in kind of an abnormal way. But in all, not in all, but in most situations they're going to be unresponsive, or again, look for those other things like sudden falling to the ground.
Some people have something, a focal seizure, where it could look as simple as like them like me staring at locations and just like going like that. You might not think it's a seizure, but any repeated movement, you can't get their attention, they're not responding to you, they're out of it. It might just be that small, not just something you don't see very often, but it's that.
Can you confuse that for like a twitch? Or like a...
Yeah, possible. I would say the only seizures that I've seen like that have been like not super noticeable at first have been like twitching of their whole mouth. You know what I mean? Like twitching when I'm trying to talk to them, and they're completely. The thing is like even though their eyes are open, they're unresponsive. You know, they're not answering any questions. They're not making any signs that would show me what they are. So I think that's.
Okay.
Who is it? Mary Sally.
Oh, it's me. Okay, so protect from an injury. So this is like a big one, especially for braces. Like the most important thing you can do is protect the person from getting further injured. So if Jillian, sad to say, but she has seizure right now, we want to move the tables and chairs around her to make sure that she wasn't like, hitting her on the wall or the table or anything. That's what we do. And loosen restricted clothing, kind of the same reason for fainting. Roll victim onto their side into a recovery position, because we talked about earlier, we don't want to be aspirin on anything. And then definitely call 911 if the seizure occurs for an unknown reason. For instance, you don't know that this person has epilepsy. And I really think that'd be the only, unless I have a seizure disorder and this has happened before, I would definitely call 911. You know, because this could be a sign of a brain injury.
You said something about an aspiration, what's that?
Oh yeah, sorry, that's just another word for throwing up and like choking on like those aspirations. Like that's when you lay down and you choke on your saliva, throw up, mucus.
Loosening restricted clothing, is that the same as like?
Wait, you guys still have 3 more.
Actually, we are going to do the rest.
Caroline,
Next
no.
one.
Yeah, I'm fine.
Yeah. We're going to do nice class.
Did anyone have questions?
Oh,
Oh, I
yeah, I
got
was
it.
gonna ask, when you loosen your restricted clothing, is that the same as like moving through your respiratory?
Same, you're doing it for the same reason, to prevent further injury. Let's say like someone had like, let's use restricted clothing. A scarf, great, on top of it. A scarf, that could restrict their breathing, right? And that could get in the way, especially if they're moving and convulsing. Like convulsing, I definitely would say try to take it off.
Or like someone's playing football, like their whole like uniform, that's pretty restricted.
Yeah, very true. Or like a helmet, if you could.
Okay, so shock, we've touched on this a lot in the care for shock with practicals, and anaphylactic shock we touched on a little bit in the beginning. So now we're going to kind of just talk about it a little bit more focused. So what it basically is the failure of the circulatory system. So pump and heart failure, other things that could lead to this, again, is part of the circulatory system failure. Is fluid loss, again, like I said, pump and heart failure, and pipe failure, which is like your blood vessels. And then this often results, as we kind of talked about with practicals, from serious illness or injury. So, what's some practical if they had, someone broke their leg, that's a pretty serious incident, right? So you definitely want to make sure, again, to treat for shock. Or hey, you had a controlling bleeding station, right? They're losing, they either have lost, hopefully not too much because you were there, but they're losing blood and it's a pretty serious incident. So again, you want to make sure to control the bleeding, or not control the bleeding, treat for shock.
And really quickly, does anyone remember how we treat for shock? You just couldn't even help myself. Recognizing shock. So you want to recognize, these are very important. Sometimes it's a little difficult. That's why we always just add treat for shock. Why not? Why not play on the safe side and do it up now? So altered mental status is a big one. Anyone acting out of super out of the ordinary, maybe can't, tell you what day of the week it is, something like that. If they're pale, cold, and clammy skin, this is not a good sign. Nausea and vomiting is definitely a sign that means they are losing some fluids too. I think rapid breathing, and unresponsive in late stages. So if someone's unresponsive for a large period of time, they could definitely be removed.
So, we don't even need to go over this one. We'll just skip it. You guys know. Okay, so emergencies during pregnancy. Some things we're going to focus on here. So, vaginal bleeding, cramps in the lower abdomen, swelling of the face or fingers, severe continuous headaches, dizziness or fainting, blurring of vision or seeing spots. You guys know sometimes when you like stand up quickly, you like can like see spots in the sky.
I
One of those
fainted
things.
once.
Oh yeah, that happens to me all the time.
So
That's like a different issue. And uncontrollable vomiting.
Okay, so care for emergencies during pregnancy. Again, this is only like 2 slides, I'm pretty sure, as our whole thing. So not part of first aid or really like what me and Thomas did. Very, very tall. So you want to keep the victim warm and on the left side. The left side, if you, we'll go over it. But it just helps with the positioning. So for vaginal bleeding, just place a sterile pad over the opening of the vagina. We carry these on the and then save the blood-soaked pads and send them to the hospital with the victim. Sounds kind of odd, but really just to show the doctors how much blood they're losing, especially during pregnancies, this really can tell you, how weak you are at this stage of pregnancy. And then you want to seek medical care, obviously. Pretty big with this. And this just shows like the left side. As you can see, kind of confusing, I know all that just like stuff, but when you lay on the left side, it stops like I guess it stops where it helps the blood flow between the baby, or it helps the blood flow between the baby and mom if you're laying on the left side. So you
But you want to promote, right? Because if the mom is losing a lot of blood or for whatever reason, then you want to make sure that at least mom is important too, of course, but make sure that the baby is healthy.
and sometimes you can do that by just like laying them on their left side and putting blankets behind their back so they really stay in that position. And often, like laying on their side will be more comfortable than lying.
All right, so now on to strokes. Like Tristan, when he walked in today, he had a little stroke, but now he's doing better, at least it seems like. So how is it? What is a stroke? So it's caused by a blockage or rupture of a blood vessel in the brain that prevents blood flow and proper oxygenation to another part of the brain. So again, this is a very brain, almost like seizures, right? Very brain focused thing. But this one again is caused by most of the time, well, at least in my experience, most of the time it's been blockage, but as well rupture of a blood vessel in the brain. Yeah, Dalton. Oh, absolutely. Yeah, strokes are very, very serious calls. If someone is having a stroke, one thing interesting about EMS is that people don't know this. So, when we go to a call with like the lights and sirens on, we very rarely go to the hospital with the lights and sirens on. People think that, or I don't know, at least people I've talked to think that we go lights and sirens to go places. But that's not true. But we only go for very serious incidences, lights and sirens to the hospital, and if someone's having a stroke, that would be a situation that they would. So it is definitely life-threatening. Yeah.
Even if you only like don't know they're having a stroke, you think it might be like a stroke.
Yeah, exactly. Yeah, bro.
Is stroke part of like
A stroke is more serious than an aneurysm, I'd say. But again, also just kind of focusing on the brain aspect of it and the blockage and the rupture. I don't think we talk about aneurysm, maybe we do. But I would just kind of stay focused on that, and I don't think we'll be testing this week. Yeah, on the next slide. Yes, Will.
Yeah.
All right, so how are we going to test? I don't know why. So yeah, how are we going to? I'll figure it. How are we going to test how are we going to test if someone's having a stroke? So we have another acronym, FAST. We have blue to the sky, orange to the thigh, FAST, and then what was the other one I had?
Low, hypo.
Yeah, low, hypo,
Hyper,
hyper, high. Yeah. So we've
That
got
one's not
no, but low, hypo,
like the
low, hippo. Like that. Okay, but here's another one. I totally agree. Here's another one is FAST. So the FAST, so what it stands for? It's face, arms, speech, and time. So, what? Oh, absolutely. So the first thing, face, you're going to ask the patient to smile. So basically with all these, by the way, you're looking for, and we'll either talk about it or say on the slides, you're looking for something out of the normal, but in particular, someone favoring one side or another, or grouping of one side or another. So you're going to ask the patient to smile, look for that facial droop in particular. Their arms, if someone has an arm drift, so what that means basically is we'll show an example, but one arm is basically higher than the other. And then have them repeat, you can't teach an old dog new tricks. And that's basically to see if they're slurring their speech or if they say something else that they say that you can't, teach an old or a new cat how to eat an orange or something like that. Yeah, then they're really not doing well, so you definitely want to make sure. And then also, the time aspect's not really a test, but you just want to make sure that you identify how long ago the symptoms have started. So I guess we're doing it in the, am I the stroke? Or?
Yeah. Okay. You already.
Oh wait, but I can't take my mask. You know what? No, I can't take my mask.
No.
Oh, okay.
Right. So this is like in your practicals if you have to do this, right? So, you're halfway through your practical, whatever. First, I'd say, do you mind giving me a nice big smile from your teeth?
So I'm having trouble.
You're happy.
Okay. It's very hard to do that. It's hard to fit.
Then I'd say, but can you hold your hands
Wait,
up?
I can put it, yeah. Hold my
Can you
hand
hold
down.
your hands up, palms up, close your eyes? And you can like show them how to do it out. Then you just, okay, you can open your eyes with your arms down.
So this is what it should be, like this, and then this is what first stroke
And
is.
just make sure, like, say, can you hold your arms up, palms up, close your eyes, and then the leg goes back. And then you can say, put it down, open your eyes, and then can you repeat after me, Thomas? You can't teach an old dog new tricks.
You can't teach
Good, good. And then do you know how long ago you started to feel like this?
half an hour.
That is how you do it if you're practicing.
And also notice, by the way, for face, so in general it'll be favoring one side of the body. So if my smile was leaned this way, then my arm would be down like this, and then my speech, obviously there's not one side of it.
You might like walk in the room and like you can stop. And this is really obvious for example, like if they're like they're leaning over like this, they can't pick up the side of the body. You know what I mean? That's definitely correct.
What about the you can't use an old dog new tricks up the stroke?
So basically, because that's just kind of the phrase that we use. It's not. Yeah, you can use. Well, yeah, but basically that's like the EMS standard of it. But the reason why is again to test to see if they're slurring their speech or if for some reason they mix up the words. So there's no like reasoning like scientific method to. Oh, this is why we do can't teach no long tricks. It's just the same. Kristen.
Are stroke patients always possible?
No, not always. They won't be. That they probably won't. They might be responsive to like painful stimuli, or maybe they'll be like if you like say like ma'am, can you talk to me? They might go like like they might like just kind of come back with a blank noise. But you can have patients that can like kind of talk to you. Again, someone who does have the can't teach an old dog new tricks, but it's not very severe. They'll just have a slurred speech, right? So they're able to talk to you. It's just going to be a little bit difficult to understand them. So it really all depends. They could be completely unresponsive and having a stroke, in which case that would be a much more serious issue, obviously. Or they could be, in decent shape. I mean, again, it's a very serious issue, but it could be in decent shape still.
I have 2 questions. First,
Yep.
should you just take their word for the time?
So at least in my experience, you wouldn't actually ask. If no one else was there, 100% ask the patient. A lot of times though, there will be someone who would have called 911, but in your case as a first aider, there will be someone else there, like a bystander, that you could ask that to. Because of course, if they're not oriented and they can't repeat, you can't teach an old dog new tricks, it's going to be hard for them and hard for you to trust that, oh, it did start half an hour ago. So you really want to try to get it from someone else who can kind of testify that, oh, it was an hour ago, it was half hour ago. And strokes can last a really long time. I've had a patient once that had a stroke, or, well, the stroke symptoms started at like 8 a.m. and we didn't have him until midnight the next day. Took him to the hospital, and he was still experiencing those symptoms.
And it helps the hospital know when the time is, because that determines what medications and what procedures they can do on them, because it's super time sensitive.
And then
Yeah.
also, when you do the same thing for the stroke if they were drunk, or I mean like,
So if someone's drunk, they're not going to have they might have something like slurred speech if it's pretty severe, but they're not going to have, I mean, it would be crazy if for some reason they were exhibiting symptoms of a stroke, right? They're not going to have facial droop, they're not going to have the arms, and for the most part, they'll be, well, they don't know, of course it depends, but they could be relatively with it more so than a stroke patient. So a stroke is more severe than something like alcohol intoxication. And the only thing that is similar is like the slurred speech, but nothing really important. Yeah, Caroline.
I'm like a little confused with your example, how you said like the sun will stop, like do they go, like when they stop, do they go away, like through the arm?
Yeah, so what, are you basically asking when they go away?
Because isn't there like, because I know my grandma had one, she like had, like her arms like still weren't working like after
Yep.
the
Yeah, so they don't always go away, and actually, at least the patients I had one that I had again, and they had a situation like that, right? They you know, they're, at the time that they were having the stroke, he or she couldn't move their right arm, and when we came back again a few weeks later, he or she still couldn't move their right arm. So there are situations like that. There are other situations where the symptoms will resolve, or of course in the hospital, they have very advanced procedures to go in to basically fix the issue. So again, it also is a time issue as well, because the longer that they wait before you can get to the hospital to do advanced procedures, the more damage could have been done to the rest of your body. It all depends.
This fall that you went back, you know what I mean, like that patients have been having symptoms for like a day and a half.
Oh yeah, that one too. Yeah.
It doesn't mean that, oh, well, you know, when he waited 2 days, they might have gone away. It means that he just hadn't realized he was symptoms until, you know, he still had a stroke, he just didn't go to the hospital.
since they're having like blood clots or like just blood problems, and like, is that also for the rest of their body or just their body?
So, no, it is solely rooted in the brain. But of course, think about we got a state police officer coming back. Just kidding, sorry. I thought it was going to be state police officer. Yeah, they're going the other way. So the answer is no. It's rooted in your brain, right? It's rooted within those blood vessels. But it affects, of course, your brain kind of really controls your whole body, right? Your brain and your heart are probably the most important organs you have. I guess that's debate sometimes, but you know, if your brain isn't working properly, then that's why like someone's arm will be drooping, right? Because now they can't properly send signals down to your arm to stay up, or they can't send signals to your your mouth and your tongue and your vocal cords to make the sound, and your lungs to make the sound to repeat. You can't teach them all down. So it's all rooted in the brain, but that affects the rest of the body.
Like there's no blood flow there.
In their arm?
Yeah.
Yeah, exactly. So the blood flow would be, because the blood flow is related to the heart, and the heart, there is a chance that the heart could stop beating, of course, too, because that's the danger of strokes, because the brain tells your heart to beat. So right? No, it's not. It does. No, it does. It does.
Your brain's done that.
Yeah, exactly. So your brain does start to tell your heart to beat. So now suddenly that process is messed up. Then the heart stops beating, and then obviously that's a much more serious issue.
By the way, you don't have to know.
Yeah, you don't have to know any of that. That's just.
This is like, you
Okay.
Okay.
Yeah.
Okay, thank you very much. Okay, so symptoms of a stroke, again, that kind of covers the main ones you look for and you test for. You can also see altered mental status, confusion, one-sided weakness or numbness, slurred speech, lack of balance is a big one, blurred vision, headache, this is a super big one. So a lot of times we'll walk in the calls and the patient will be like, having the worst headache of my life. That is a sign of stroke. And coupled with another symptom that really becomes more obvious, but we'll also get dispatched a person with a very bad headache, possible stroke. So something to think about. And a loss of sensation, maybe they can't, feel their right arm or their finger or something like that.
Example of facial droop, probably a little bit better than mine. See how the right side of her face there is drooping.
And you can see the clot in her, her brain right there. See how part of it's blocked and it's not getting the blood it needs for the rest of the day.
Yep, Maggie.
Is it just like a random what side juice?
What side? It also can be like if you get a stroke on like this side. Yeah, I mean I don't know the technicalities of it, but
I think they're opposite, right?
yeah, I think if you get a blood clot on your left side, your right side of your body's gonna be fine. Nothing is worth out again.
Alright, so how are we going to care for a stroke? Call 911, of course, very serious issue. Monitor ABCs. You guys all know ABCs? Nice. Okay, destroyed everybody. So airway, breathing, circulation. Monitor the patient or position the patient on their back with their shoulders slightly raised. Why do you think you do that? Position them on their back with their shoulders slightly raised. So
No, not like.
I would say, like,
I think they mean like if you're sitting on the stretcher, right? Like you're just like.
Oh.
yeah, like sitting up like a little bit, like with a pillow or something behind them. Any ideas? Yep, go on. Yeah, so the way I always thought about it, yeah, I think you're on the right path. So the way I always thought about it is, you have the blood clot in your brain, right? So any way that you can try to reduce the effect of that, whether it's, slightly reducing the amount of blood that's, going to your brain, could be beneficial. I'm not sure exactly the etiology behind it, but I think that that's probably where I was rooted.
Yeah, well, you also don't want the blood in your brain to really leave your brain anymore. You know what I mean? You know when you hang upside down and all the blood rushes to your head?
Yeah.
That's you don't want that.
Hey, you don't want that.
Yeah,
So
you want
you,
to like.
you kind of want perfect balance. If it's on the test, shoulder slightly. Alright, cool.
Alright, so OPQRST, another fun little acronym.
Alright, let's review. Blue to the sky, orange to the thigh. Fast. What does fast stand for?
Face, arms, feet.
Perfect, good. And then hypo, low, hyper, high. And that's it, right?
Yeah, now our new one,
Now our new one.
OPQRST. Keep this one in mind, just like you use, dots and sample on our last practical. This will be used in your final practical. So, onset. Did the symptoms come on gradually or suddenly? Provocation or provocation. What makes the patient feel better or worse? Quality, can the patient describe their pain? Radiation, is the pain radiating anywhere? Severity, how is the pain on a scale of 1 to 10 or 0 to 10? And then how long ago did the symptoms begin? So you really are asking these questions anytime you have, an illness or something in there more on the medical side, and if you can't tell the beginning of the class is related to trauma, after the midterm we go on to medical. So any medical call, you're going to use this. If they have a headache, you're going to go through each and every one of these questions. If they have chest pain, the same thing. You're basically just asking the question in order to but important. Make sure you get all.
Radiation, is that just spreading?
Yeah, it's like if you have chest pain, sometimes the side of heart attack is if it radiates down your left side. So you literally are just saying there's nothing fancy, you can just repeat exactly what it says on the screen. Is your pain radiating anywhere? Is it?
Sure.
Test for provocation.
Provocation, yeah. So that's again just from the patient, right? Does anything make you feel better? Maybe you have, I guess to answer your question, yeah. Maybe have the patient sit down, have them stand up, have them lay down. What environment is most comfortable for them? Maybe they're too hot, too cold. You want to find, not only to make sure that they stay healthy, but of course that can be valuable information for the hospital once you get there, or once EMS arrives.
If they have chest pain, you can ask them that, maybe they'll give you an answer oh well, breathing needs to be work.
Yeah.
That's right.
Oh, that's it. All right. Any questions? So we'll give you, oh, we haven't got 2 questions. Yeah, Avery.
How many like kids do we have to have?
Oh, have till next? Only like 2 or 3.
Yeah, only one.
Only one.
One, and then
No.